As a nurse, it's really difficult. If you don't want to work because of COVID, you're scared of COVID, you can't do that because as a nurse, you promise that you will be there for your patients and you have to stick to that no matter what.
Ang pandemya ng coronavirus ay nagdulot ng kahirapan sa mga manggagawa sa pangangalaga sa kalusugan katulad ni Marie Encinas.
Just to be there with the patient because thinking about it like the family member cannot even be there and witness them or hold their hands. At least they're there. You are there for them to hold their hands on their last breath.
Sa Bay Area, 17% ng mga nurse ay Pilipino. Iyan ay higit sa 3 beses sa pambansang pamantayan.
A lot of Filipinos who were working in that field had caught the COVID, and when they go home, a lot of us lived together. So a lot of families was getting sick, their kids, their parents, and actually brought death to some of the families in our neighborhood.
Si Rudy Corpuz, isang pinuno sa komunidad ng Filipino sa San Francisco, ay sinasabi na ang epekto ng pandemya ay nakakawasak.
One death in the community is too many. It's like a ripple effect. It's like throwing a rock in a pond and seeing the ripples. It affects everybody.
Sinasabi ng mga eksperto na mahirap sabihin kung gaano ang kahirap ang dinanas ng mga Pilipino ukol sa virus dahil ang kanilang impormasyon ay kasama sa lahat ng Asian Americans.
This pandemic affected our business definitely tremendously.
Si Payumo ay isa sa may-ari ng Señor Sisig restaurant sa Mission District.
From the loss of staff, a percentage loss of business, and overall I think we've learned to adjust and kind of pivot throughout this time in the pandemic. Unfortunately, at the same time, we had to let go of some people. We've been in business for almost 11 years, and we've been through some ups and downs, and I think this is a big challenge for us.
Ngunit ang hamon na iyon ay nagiging mas madali salamat sa rollout ng bakunang COVID-19.
Over 50,000 participants nag-volunteer para sa clinical trials for this COVID vaccine.
Ang mga doktor na sina Rochelle at Michelle Tinitigan ay nagtatrabaho sa Kaiser San Francisco. Sinasabi nila na ang lahat ng kasalukuyang mga bakuna ay ligtas at 100% na epektibo laban sa pag-iwas ng pag-ospital at kamatayan. Layunin sa ngayon ay mabakunahan ang lahat.
Initially, I was also afraid of it, and I've been telling around my friends I'll never get it and I'll just try to be as healthy as I can be, but I realized that I am powerless before Miss COVID-19.
Sinabi ni Father Ed Dura ng simbahan ng St. Augustine sa South San Francisco na nabakunahan siya dahil sa kanyang responsibilidad.
Personally, I have buried someone who have been infected with COVID, and it was devastating. The only ways for us is to defend ourselves, and that is vaccinating.
Importante po tayo magpabakuna para magkaroon po tayo ng herd immunity. Ang herd immunity ay nangyayari kapag may sapat na tao ay naging immune sa coronavirus at para maprotektahan po natin ang mga ibang taong hindi pa nagpapabakuna.
Sinabi ng FDA ang pangkalahatang epekto ng bakuna ay ang mga sakit sa braso, pagkapagod, sakit ng ulo, panginginig at lagdat.
There's a lot of stories and people are totally negative about it, but I'm looking at more of a positive note.
Isang kahalagahan na ang bakuna ay maaaring may epekto sa mga susulit na mabuntis.
Wala pong report na may epekto sa fertility ang COVID vaccine. Ang bakuna na to ay safe para sa mga buntis at mga nagbe-breastfeed.
Sinasabi ng mga eksperto sa medikal ang iba pang mga kinatatakutan na ang bakuna ay naglalaman ng COVID-19 virus ay magbabago ang DNA ng isang tao o magtanim ng isang microchip ng pamahalaan ay walang katotohanan. Ang katayuan sa imigrasyon ay walang epekto sa kakayahang makakuha ng bakuna.
So for me personally, super importante na makuha ko yung vaccine dahil ang mami ko is 93 years old.
Sinasabi ng pinuno ng komunidad na si Perez na ang Pilipino ay isang social bunch at hindi makapaghintay na ipatuloy ang mga pagtitipon, bumalik sa paaralan at sa trabaho at yakapin ang isa't isa.
Also, in terms of mental health, importante na makuha natin yung vaccine para alam ko na maraming tayong kilalang mga tao na they're going through anxiety and depression dahil nasa loob ng bahay. So once we have the vaccine, then we can go out again.
So I was the first one who signed up.
Si Marie ay hindi nag-atubili na magpabakuna dahil sa kanyang lola ay namatay dahil sa COVID at ang kanyang ama na nagpalaki ng 7 bata bilang magsasaka sa Pilipinas.
He went to a coma, so we took him to the hospital. So he was in ICU for a month, intubated, and I was able to see him. He couldn't recover for the intubation, so they have to do a tracheostomy. And he didn't make it.
Kahit marami na ang nanakaw ng COVID sa komunidad ng Pilipino, buhay, trabaho, negosyo at ilang kaligayahan, ang mga Pilipino ay matatag na mga tao.
I'm gonna do what I've been doing. Frontline soldier, boots to the ground, 10 toes to the floor, helping out our people.
Importante po, pag may chance kayo makakuha ng COVID vaccine, huwag niyong papalipasin ang opportunity na ito.
Like seeing a really big light, out of the tunnel. Like, we have hope. After all of all those sacrifices, of all those pain and suffering that we went through in 2020, that there is hope for all of us.